Hey everyone, welcome back to the channel. Today, we're diving into a topic that sparks a lot of debate, a lot of passion, and a whole lot of questions. What if the United States had free healthcare? Now, when we say free, we're generally talking about a universal, single-payer system where taxes cover healthcare costs for everyone instead of private insurance premiums, deductibles, and copays. It's a huge what if, and exploring it means looking at potential changes, both good and bad, that could ripple through every part of American life. So, let's start with the most obvious and immediate impact: your wallet. Imagine a world with no more medical bills showing up in your mailbox. No more heart-stopping moments when you see the cost of an emergency room visit or a necessary surgery. For millions of Americans, this would be life-changing. Medical debt is a leading cause of bankruptcy in the U.S. A universal system could wipe that slate clean for future generations. The constant stress and anxiety of affording care would lift, freeing up household income. Instead of paying hefty insurance premiums each month, that money could go towards a down payment on a house, starting a business, saving for retirement, or simply enjoying life a little more. The economic freedom this could unlock for individuals and families is massive. But where does the money come from? That's the billion-dollar, or rather, trillion-dollar question. Free healthcare isn't actually free. It's publicly funded. This would mean higher taxes. The exact structure could vary. It could be higher income taxes, a dedicated payroll tax, or new taxes on corporations or wealth. Proponents argue that for the majority of middle and lower income families, the tax increase would be less than what they currently spend on premiums, deductibles, and out-of-pocket costs combined. So, while you'd see more taken out of your paycheck, your overall household expenses on healthcare could actually go down. High-income earners and corporations would likely see the most significant tax hikes to fund the system. The debate here is fierce. Would these higher taxes stifle economic growth and investment, or would a healthier, more financially secure population boost the economy in the long run? It's a fundamental question about how we, as a society, choose to pool our resources for the common good. Let's shift gears and talk about health outcomes. This is where the what if gets really powerful. With financial barriers gone, people would be more likely to seek preventive care. Think regular checkups, cancer screenings, and managing chronic conditions like diabetes or high blood pressure before they become catastrophic. Right now, many people delay or skip care because of cost. A universal system encourages a proactive approach to health rather than a reactive one. This could lead to earlier diagnoses, better management of diseases, and ultimately a healthier population with a longer life expectancy. The U.S. currently lags behind many other developed nations in key health metrics, despite spending far more per person. A universal system could be the key to closing that gap. Furthermore, imagine the impact on public health crises. We all just lived through a global pandemic, and it starkly highlighted the cracks in our system. With universal health care, things like testing, treatment, and vaccinations could be rolled out more efficiently and equitably without cost being a barrier for anyone. It would strengthen our collective ability to respond to widespread health threats, making everyone safer. A healthier population isn't just a collection of healthy individuals. It's a more resilient and productive society. Now, let's address the elephant in the room: wait times. This is one of the most common arguments against universal healthcare. Would we all be stuck in long lines waiting for appointments and procedures? It's a valid concern. Countries with universal systems, like Canada or the UK, do experience longer wait times for certain non-urgent, specialist procedures. The demand for care, when it's free at the point of service, can certainly increase. However, it's not a simple cause and effect. Many factors influence wait times, including the number of doctors and nurses, hospital capacity, and how efficiently the system is managed. A well-designed American universal system could learn from the successes and failures of others. It would require massive investment in medical infrastructure, training more healthcare professionals, and embracing technology like telehealth to manage demand. So, yes, wait times are a potential challenge, but they are a logistical problem to be solved, not an automatic consequence. It's about how we would choose to build and fund the system. What about innovation? America's healthcare industry is a powerhouse of research and development. Many of the world's most advanced drugs, medical devices, and treatments are born here. A common fear is that a single-payer system, where the government negotiates prices, would slash the profits of pharmaceutical and biotech companies, drying up the funding for research and development. If companies can't charge high prices, would they still invest billions in discovering the next miracle drug? It's a serious question. Proponents of a universal system might argue that a lot of foundational medical research is already publicly funded through institutions like the National Institutes of Health. They might also suggest that the government could directly fund innovation, tying it to public health needs rather than profit motives. It would represent a fundamental shift in the business model of medicine in the U.S., and the exact impact on the pace of innovation is one of the biggest and most complex unknowns in this entire scenario. Let's think about jobs and the economy on a larger scale. A universal healthcare system would dramatically reshape the labor market. Right now, health insurance is often tied to employment. This creates a situation known as job lock, where people stay in jobs they don't like or aren't suited for, simply to keep their health benefits. Decoupling healthcare from employment would be incredibly liberating. It could unleash a wave of entrepreneurship, as people would be free to start their own businesses without fearing the loss of insurance. It could allow for more flexible work arrangements, caregiving, or early retirement. This newfound labor mobility and flexibility could make the entire economy more dynamic and innovative. On the other hand, the private health insurance industry, as we know it, would essentially disappear. That's a massive sector of the economy, employing hundreds of thousands of people in administration, sales, and management. A transition to a universal system would need a plan for these workers. Would their skills be transferable to managing the new public system? Would there be job retraining programs? The disruption would be significant, and managing that transition fairly would be a critical challenge. The entire economic landscape would shift. Hospitals and clinics would also change, moving from a complex web of billing different insurers to a single, streamlined administrative system. This could reduce administrative waste, which currently accounts for a huge chunk of U.S. healthcare spending. That saved money could be redirected back into actual patient care. Finally, let's talk about something a bit more abstract but incredibly important: the cultural shift. What if healthcare was viewed not as a commodity to be bought and sold, but as a fundamental human right like K-12 education or access to the fire department? This would change our social contract. It could foster a greater sense of community and social solidarity, knowing that everyone, from the wealthiest CEO to the person working a minimum wage job, has access to the same standard of care when they get sick. It reframes vulnerability not as a personal financial risk, but as a shared human experience that we collectively safeguard against. This shift in mindset could have profound effects on our politics, our communities, and how we see our obligations to one another as fellow citizens. It changes the answer to the question, am I my brother's keeper? So, what if the U.S. had free healthcare? It's not a simple utopia or a disaster, it's a complex trade-off. We might trade lower direct costs and greater financial security for higher taxes and potential wait times. We might trade the current model of private sector innovation for a more publicly guided approach. We would gain a healthier, more economically flexible population, but have to navigate the massive disruption of an entire industry. There's no single easy answer, and every country that has gone down this path has its own unique story of successes and challenges. The real question isn't just what if, but what are our priorities? Is it individual consumer choice and private market competition, or is it universal access and collective security? That's the core of the debate. Thanks so much for watching and pondering this huge question with me today. It's a conversation that affects every single one of us. I'd love to hear your thoughts in the comments below. What do you think would be the biggest benefit or the biggest challenge? Let's keep the discussion respectful and constructive. If you found this video thought-provoking, please hit that like button and subscribe for more deep dives into the big questions shaping our world. See you in the next one.